You know, when you hear the term heart failure, it's easy to picture it as just one single thing. But that's not really the whole story. In fact, it's more like a tale of two very different problems, a tale of two pumps. Let's really get into what that means. So, what even is heart failure, technically? Well, the official universal definition calls it a clinical syndrome. Now, that's just a fancy way of saying it's not something you find with a single test. Instead, it's a collection of signs and symptoms, like feeling short of breath or having swollen ankles, that all point to an issue with the heart's structure or how it's working. And then doctors confirm it with hard evidence like blood tests or an ultrasound. And this is where our two pumps come into play. The big difference boils down to something called ejection fraction, which, simply put, is just the percentage of blood the heart pushes out with every single beat. So on one side, you've got HFrEF, which stands for heart failure with reduced ejection fraction. This is what we call a weak pump. The heart muscle just isn't strong enough to squeeze hard, so its ejection fraction is low, under 40%. But then you have HFpEF, heart failure with preserved ejection fraction. This is the stiff pump. The muscle is plenty strong, but it's too rigid to relax and fill up with blood properly. So even though its ejection fraction looks normal, 50% or higher, it can't get enough blood in to then pump out. So in this explainer, we're going to dig into both sides of heart failure. We'll kick things off with a solid, proven game plan for the weak pump, the 4 pillars. Then we'll try to solve the puzzle of the stiff pump. We're also going to bust a huge myth about side effects, and finally, we'll take a peek at what's next for treatment. All right, let's start with HFpEF, the weak pump. Because for this condition, we now have a really clear, evidence-based strategy that has totally changed the game for patients. That strategy is what doctors call Guideline-Directed Medical Therapy, or GDMT for short. Now, this chart might look a little complicated, but the main thing to focus on is what we call the 4 pillars. These are 4 different types of medication that, when you put them all together, create the absolute gold standard of care. This isn't just a guess. It's a combination that's been proven over and over in major clinical trials to save lives. So how do these 4 pillars actually work as a team? Well, first you have ARNIs, which fight back against hormones that strain the heart. Then you've got beta blockers, which basically act like a shield, protecting the heart from the damaging effects of adrenaline. Third are MRAs, which block a hormone that causes nasty scarring and inflammation. And the newest pillar on the block, SGLT2 inhibitors, they not only help the body flush out extra sugar and water, but they also have these amazing direct protective effects on the heart itself. So what happens when you use all 4 pillars? Well, the impact is staggering. A major analysis estimated that for a typical 55-year-old with HFrEF, getting on all 4 of these medications adds an incredible 6.3 years of life. That just shows you how powerful this blueprint really is. Okay, so for the weak pump, HFrEF, we've got a solid playbook. But what about the stiff pump, HFpEF? Well, for a long time, that's been a much tougher puzzle to solve. Yeah, for years, this was the question keeping cardiologists up at night. We had this amazing, life-saving strategy for the weak pump, but what were we supposed to do for the millions of people whose hearts were stiff, not weak? And as you can see, the approach to HFpEF is a totally different ballgame. It's not a simple 4-pillar strategy. Instead, doctors have to get much more personal, targeting specific profiles or phenotypes, like whether a patient has a lot of fluid buildup, inflammation, or issues with obesity, and they use that to guide the treatment. And the good news is we are finally making some real progress. The SGLT2 inhibitors, one of the pillars for the weak pump, now have a strong recommendation for HFpEF too, because we know they reduce hospitalizations. Other drugs like MRAs and ARNIs have what's called a Class 2B recommendation, which just means the evidence isn't quite as rock solid, but they're definitely worth considering for some people. And then there are fascinating new therapies like GLP-1 agonists that are proving to be a game changer for patients whose HFpEF is driven by obesity. And the complexity doesn't just stop with the treatment. Even diagnosing HFpEF is way trickier. Because the ejection fraction looks normal on paper, doctors often have to use these complex scoring systems that mash together a bunch of different clinical factors and imaging results just to figure out how likely it is that a patient actually has this stiff pump problem. Okay, so we've talked about all these incredible life-saving therapies, but there's a huge elephant in the room: the fear of side effects. And this is such a critical thing to understand for anyone living with heart failure or, caring for someone who is. I absolutely love this quote from the source material because it just gets right to the heart of the matter. There's this common fear that the medications for heart failure are so bad with so many side effects that they're just not worth it. But the data? Well, the data tells a completely different story. And let's be super clear, feeling unwell is common. In the landmark clinical trials for these drugs, a whopping 85% of people reported at least one adverse event, basically something that made them feel worse. That's a huge number, and it completely validates why patients get so concerned. But, and this is the absolute key, here's the twist. In those studies, half the people got the real medicine, and the other half got a placebo, a sugar pill. And what they found was just mind-blowing. The rates of feeling unwell were almost identical in both groups. People on the sugar pill reported feeling just as bad as the people on the actual drug. This chart right here, this tells the real story. It wasn't just that the minor side effects were the same. When they looked at serious problems, the kind of thing that lands you in the hospital, the real medications were actually protective. You can see it clear as day. Patients on these crucial therapies had a lower risk of serious trouble compared to those on the placebo. The treatment wasn't the problem, it was the solution. So what does this all mean? The crucial point is this. A lot of the things patients blame on medication side effects, like feeling tired or dizzy, are very often just symptoms of the heart failure itself getting worse. The disease is progressing. And in those moments, stopping the life-saving medicine can actually make things much, much worse, not better. All right, let's pull all of this together. We've looked at two very distinct conditions, hiding under the single umbrella of heart failure. And we've seen that the treatment for both is evolving at lightning speed. So let's wrap up our tale of two pumps. For HFrEF, the weak pump, the main problem is squeezing blood out. The diagnosis is pretty straightforward, a low ejection fraction, and the treatment is that proven four-pillar strategy. For HFpEF, the stiff pump, the problem is all about letting blood in. The diagnosis is way more complex, and the treatment is becoming an evolving toolbox of therapies targeted to the individual person. And this all leaves us with a really fascinating question for the future. We've already gone from a one-size-fits-all approach to these highly targeted therapies for the stiff pump. So as our understanding keeps growing, are we going to move beyond just two types of heart failure? Could we one day have a unique, personalized pillar approach for every single patient? You know, it's a future that seems closer now than ever before.